Hi, it's Ron Bender, and I'm reporting to you live from the EADV in Berlin 2023. And Mark Kirchhof from Ottawa is going to report on his second video of different aspects of the late breaker, which include HS, hidradenitis suppurativa, as well as alopecia areata. In the hidradenitis suppurativa, he's looking at a new type of approach called the heat shock type protein. And for alopecia areata, he is going to look at the JAK inhibitors.
Hello, Mark Kirchhof, dermatologist from Ottawa, Ontario, Canada, reporting to you from Berlin, the site of the EADV 2023. I did have the opportunity to attend the late breaker session today on the first day of the Congress, and there were some really interesting sessions. I'll be talking to you in this short video on hidradenitis suppurativa and alopecia areata. And so the first presentation that was of interest was a double-blind, placebo-controlled randomized trial evaluating the efficacy and safety of a heat shock 90 inhibitor. So it's RGRN305 in the treatment of hidradenitis suppurativa. So this was a small study, only 15 patients, sort of a proof of concept, but a completely new and novel mechanism of action. So targeting heat shock protein, or HSP90, has not been done to date, and it did show efficacy. So patients achieved high score 50, 75, and a portion did achieve a high score 90. So very encouraging results for a molecule that's very early in development. Moving along to a molecule that's a little bit later in development, the nanobody sonelokimab, I'll say that a few times, is an inhibitor of IL-17A and F. Very similar to bimekizumab, which we have for psoriasis in Canada, so it's an inhibitor of the same IL-17A and F. We've seen data for bimekizumab in the treatment of hidradenitis suppurativa, so the question, would this molecule perform similar or better? And it does seem to perform at least similar or perhaps slightly better. It is a nanobody, so the theory is that it will penetrate and absorb into the skin to a higher degree than a larger antibody such as bimekizumab. So some very encouraging results from this larger placebo-controlled phase 2 trial. Speaking of some conditions that are difficult to treat in our clinic, I do see a number of patients who have alopecia areata, and there was a 24-month follow-up for the phase 2b/3 study of retlicitinib for the treatment of alopecia areata, showing that yes, indeed, it does work, and that there is continued improvement, sustained improvement. It'll be interesting to see in terms of the withdrawal data if there is relapse quickly. And then the final presentation that I'll quickly touch upon is perhaps one of those novel presentations. This was looking at coecilium, which is a botanical topical used in this case for the treatment of adolescents and children with moderate to severe alopecia areata, randomized, double-blind, multi-center, phase 2/3 trial. Mechanism of action is somewhat unclear, I will say, at this point in time, but did show very encouraging results. And very interestingly enough is that even after coming off the treatment, patients seem to maintain their hair regrowth. So stay tuned. We'll see if this can be replicated. And if this result is actually true, I think it'll be a major advance for patients of alopecia areata. Again, Dr. Mark Kirchhof reporting to you from the EADV 2023 in Berlin.
In the late breakers that he discussed, this is extremely important because late breakers are showing release of new data that has never been released before. Different companies and different investigators wait for late breakers in order to determine and show the rest of the public that they've had success, and sometimes there's not even success as well. And the late breakers seem to be really focused on hidradenitis suppurativa as well as alopecia areata. And Mark discussed very interesting data with newer type molecules such as the heat shock protein compared against bimekizumab, which was known to be in previous studies effective for hidradenitis suppurativa. Their different JAK inhibitors were also discussed for alopecia areata.